Bladder cancer is the sixth most common cancer in the United States, and a lot of people, they have it and they don't even know that they do have it. A lot of times it goes unnoticed, or you might have signs, but you wouldn't pay attention to it. Today, we're going to talk about bladder cancer. Hi guys, I'm Dr. Peter Aziz, urogynecologist and pelvic surgeon. I see people pretty much every day and I diagnose them with bladder cancer. Some of them, they have it for months, for years, and they were never properly investigated. So today I'm going to walk you through the signs of bladder cancer, what do they look like, and why are they often missed, and exactly when you need to pick up the phone and call a doctor. So stay with me through the entire video. I'm going to cover some important symptoms that most people do not associate with bladder cancer at all. Before we get right into it, if you're new here, welcome to my channel. I created this because people deserve access to real evidence-based medical information in plain language. No fluff, just the fact that you need to make informed decisions about your health. Also, I offer one-on-one health coaching sessions and Q&A calls if you have things that you want to ask about or any problems that you need answers. The link is in the description below. So bladder cancer, when does it start? It basically starts when the cells that are inside of the bladder, they start to grow abnormally and out of control. Most common type, it's called carcinoma. It makes roughly about 90% of all bladder cancer cells. So here's the critical distinction I want you to understand. Bladder cancer is categorized as either non-muscle invading, meaning it's only in the inside of the bladder, or if it's invading the bladder wall, meaning that it's grown deeper into the muscle and potentially spreading. The reason why I'm explaining this because early detection when the cancer is still non-invasive dramatically improves outcomes. That is why knowing these symptoms matter. So most important sign, blood in the urine, or the fancy term is hematuria. This is the number one symptom of bladder cancer, and I need you to hear me clearly. Any blood in the urine, like if you saw blood in your urine, that would require investigation. Every single time. The only time that it can be postponed if you had an active urinary tract infection and it resolved with treatment, then that's okay. We can retest again and see if there's actual blood in the urine. If there is, then absolutely necessary to get an evaluation. So there are two different kinds of blood in the urine. There is something called gross hematuria, something that you can see with your own eyes. And there is something called microscopic hematuria. This is the blood in the urine that you do not see, but it shows up on a urine test. This is the one that usually gets missed. However, keep in mind the blood in the urine is not just the regular urine dip that you get at your primary care. The urine has to be sent for microscopy, so a urine analysis with microscopy. And the lab will look under the microscope and actually find the red blood cells in the urine. So keep in mind, if there is blood in the urine, you have an infection, that's okay, you can get treated. But it has to be repeated. If the blood is still persistent with no infection, then that cannot be ignored. It definitely needs a workup. So one thing I want you to remember, blood in the urine with bladder cancer, it does not hurt. It's painless. And this surprises people. They assume something as serious as cancer would hurt. It frequently does not, especially in the early ages. The second thing, the bleeding can come and go. So you might see blood in the urine once and then nothing for weeks or months. That intermittent pattern does not mean that the problem has resolved. It still means that you need evaluation. So if you ever see blood in their urine even once, do not wait. Call your doctor. Sign number two is urgency and frequency. This is actually quite common. And these symptoms, it happen a lot in patients with bladder cancer because these symptoms look exactly like if you have a UTI or an overactive bladder. The urgency is the sudden, strong need to urinate that is difficult to control. The frequency is urinating more often than usual, including multiple trips to the bathroom, and that can also happen at night. You can have some pain with urination or burning. Again, these symptoms can be caused by infection or inflammation or an overactive bladder. But when these symptoms appear out of nowhere or without an infection, or they keep coming back despite treatment, then bladder cancer needs to be on the list of possibilities. So why is that? Because the tumor itself can irritate the bladder lining and cause those same signals that the brain interprets as urgency and frequency. So if you're being treated repeatedly for UTIs that keep coming back, and the cultures are not consistently positive, or you are not responding to antibiotics the way you should, that is a pattern that warrants further evaluation. So do not let a repeating cycle of antibiotics without a culture-confirmed infection becomes your new normal. Sign number 3 is pelvic pain. As bladder cancer advances, particularly when it starts invading the muscle or it starts to spread, it can cause pain in the pelvis, the lower abdomen, one or both sides of the back. You can have pain on the side of the back, below the ribs. It can develop if the tumor begins to block the path of the urine from the kidneys to the bladder. When the urine cannot drain properly, the pressure builds up in the kidneys, and this is a sign of more advanced disease. Sign number 4. This is general for most cancers, and that's actually fatigue and unexplained weight loss. Whenever doctors or providers hear this in the office, it's like, I've been losing weight, and the doctor will ask, have you been trying? And you're like, no, I haven't. Then that alarms that there is cancer somewhere. So especially if you have unexplained fatigue, does not improve with rest, the weight loss, you didn't change your diet at all, you didn't change your activity level, but you are losing weight, loss of appetite. So that means that probably it's a little bit more advanced and the cancer is starting to spread a little bit beyond the bladder or the nearby organs. Taken in isolation, the symptoms, again, they're non-specific and they can be caused by many things. But if you have these symptoms with urinary changes or blood in the urine, this needs to be reported really fast to your doctor, because the doctor is going to look at it as a complete picture, not in separate, appointments months apart. Now, sign number 5 is really important. If you're unable to urinate or there are significant changes to the urine stream, why is that? Because a large tumor in the bladder can physically obstruct the urine flow, make it difficult for you to fully empty your bladder. So a weak stream or an interrupted stream or a sensation that you cannot fully empty your bladder, if you have to strain to urinate, in severe cases, complete inability to pee, which is actually a urological emergency. If you cannot urinate for more than 6 hours, you have to go to the nearest emergency room. These symptoms are not automatically cancer because prolapse or stricture or pelvic floor dysfunctions can cause similar complaints. But again, if you have the symptoms with difficulty urinating, you need to report that to your doctor. So now we talked about the signs. Let's talk about who is at risk for cancer. Because when you understand this, you can basically see whether you are low risk or you are high risk. The biggest risk factor that we see with bladder cancer is smoking. This is the biggest modifiable risk factor. It is responsible for approximately 50% of all bladder cancer cases, because the carcinogen in tobacco are filtered through the kidneys and they're concentrated in the urine, so where they sit in direct contact with the bladder lining. So if you smoke or have a history of smoking, your risk is significantly elevated even decades after quitting. The second risk factor is age, because bladder cancer is generally more common in older patients. We generally see average age of diagnosis in the 70s, but it can also happen in younger individuals. Some things that are less common, like occupational exposure, if you're exposed to certain chemicals, if you're working with dye or rubber or textile, leather or paint industries, this can increase your risk. So if you work in these industries for years, that is considered a risk factor for bladder cancer because it's chronic bladder inflammation. Prior pelvic radiation, if someone had cancer and they underwent radiation to the pelvis, that can also increase the risk for bladder cancer. Family history or genetics, if there is a first degree relative with bladder cancer, that can also increase your risk. Certain, not congenital, but certain genetic abnormalities like Lynch syndrome, for example, also increases the risk. So how do I diagnose bladder cancer? So if we suspect, then we have to do a couple of things. Number one, of course, we confirm that there is blood in the urine under a urine analysis with microscopy. We also get a urine culture to make sure that this blood is not related to a UTI. Sometimes we order something called a urine cytology, which is a test where they look under the microscope for abnormal cells or cancerous cells. It's not really perfect because it can miss some cancers, but we usually order that as a workup. The gold standard is something called cystoscopy, which is putting a small camera inside of the bladder and pretty much visualize the lining and the inside of the bladder. If there is cancer, we're able to see it and we can actually take a biopsy at the same time to confirm the diagnosis. The second very important thing is imaging, something called the CT urogram. This is a specialized CT scan with contrast that looks at the entire urinary tract from the kidneys to the bladder. It helps evaluate for tumors in the kidneys or for the ureters, because generally speaking, like cystoscopies only look at the bladder, and the CT scan is not very good to look at the bladder. It's more for kidneys and ureters. This is why both the cystoscopy and the CT, they both have to be done. Now, keep in mind, bladder cancer is treatable, especially when it's caught early. So if you're having some of the symptoms that we talked about, make sure that you talk to your doctor and get a proper diagnosis. Because a lot of times doctors will be like, hey, it's just a UTI, take antibiotics. So you have to advocate for yourself. If you found this video helpful, please give it a thumbs up and subscribe to my channel. It helps more people find this content who genuinely need it. If you have any questions, drop it in the comments below. I'll do my best to answer them. Thanks for watching. I'll see you in the next video.